Hello, welcome to Chapter 6, the Cardiovascular and Circulatory System. So we're going to look at the heart. We're also going to look at all of the different blood vessels of the body. So we're going to look at pronunciations, we're going to look at root words, combining forms, different conditions, pharmacological treatments. So we're first going to start with the heart. The heart is about the size of a fist and weighs about 10 ounces. The heart is a blunt kind of cone pointing down and to the left. It lies slightly on the left side of that sternum, this bone here in the middle of your chest, in the front. That apex of the heart is at the bottom. So that point at the bottom here, that is considered the apex. Your heart lies in what is known as the mediastinum. This is the region of that thoracic cavity between the lungs where that heart's going to lie. Your heart has three main functions. It's going to pump blood, it's going to route the blood, and it's going to regulate your blood supply. So let's look at some different abbreviations that deal with the heart. CPR, cardiopulmonary resuscitation. That should have been an R. There we go. CVT, cardiovascular technician. ECG, then electrocardiogram. So this is a way we can record the heart. EKG, it's the same thing, electrocardiogram. Sometimes it's ECG, sometimes it's EKG. It's the same exact thing. DOB. Most people, when they say DOB, they think date of birth. In the medical field, it is difficulty of breathing. Another, BP. Blood pressure. So let's look at these different roots and define them. Cardi, heart. Electro means electricity. Pulmon means lung. And thoracic or thorac means chest. So we take some of these words we just formed up above from these abbreviations and can apply up down here what they actually mean. So the heart consists of three layers: the endocardium, the myocardium, and the epicardium. Endo is going to mean inside. Myo, hope we know that one by now. Epi, in this case, means above. So this endocardium, Cardi means heart. Meaning structure or tissue. So endocardium is it's the cardiac cells that line the inside of the heart. Myocardium is the cardiac muscle tissue that makes up that middle layer of the heart and allows that heart to contract. Epicardium is that outside layer of the heart. And then we have pericardium. Peri means around. So there's two layers to this pericardium that wraps around and protects the heart. So endocardium, I said, is that inside lining of the heart. Its adjective form is that endocardial. Ischemia. This is a lack of blood supply to a tissue. Adjective form, ischemic. Necrosis is death of a tissue. Necrotic is the adjective form. And then pericardium is a membrane that covers the heart. Pericardial is that adjective form. Atrium. Atrium is a receiving chamber. So there's two atrium in the heart, and this is where blood enters the heart on both the right and the left sides. The ventricles in Latin means small belly, so it is a chamber of the heart that pumps blood out of the heart. A septum, or in Latin, partition, is a wall that divides two cavities. Then bicuspid, bi means two, so it has 2 points. The bicuspid heart valve, it's got 2 points that come together to form, or 2 flaps that form this valve. So interatrial. Inter is my prefix. Atrial. All is my suffix that means between the atria of the heart. Inter, between, ventricle, between the ventricles of the heart, my suffix. Semilunar, prefix, moon, R, like a half moon, semi meaning half or part of. AV is another word for, or abbreviation for, atrioventricular. IV, interventricular. O2, oxygen. CO2, carbon dioxide. So contraction occurs during systole. This is when blood is forced through the heart and circulatory system. Diastole is that period of rest between contractions. So this is when the heart chambers are refilling with blood to be pushed through the heart again. We can listen to the heart beats with a stethoscope. It acts kind of like a magnephone where it amplifies the sounds. So the sounds that we listen to in the heart is known as this lub dub. It's what it sounds like. And a murmur. A murmur is when a valve of the heart does not completely close. So blood continues to leak through it. We can hear a murmur with a stethoscope. So this electrocardiogram, we have different activities that are happening at each part of this electrocardiogram. This is one full contraction cycle of the heart where the lub and the dub, both parts. So it's made up of different waves. We have P wave, Q wave, R, S, and a T wave. The P wave, this is when the atria contract. The QRS wave is when the ventricles contract. And then the T wave. That is considered repolarization or recovery. So that is resting of the ventricles after contraction. Atrial is pertaining to the atrium, so where blood enters into the heart, while ventricular is pertaining to the ventricles, and that is what pumps the blood out of the heart. Bradycardia. Brady means it's low. Tachy means it's high. So bradycardia is a heart rate below 60. Tachycardia above, so it's a high, fast heart rate. That is HR for heart rate is above 100 beats per minute. When we're talking about heart rate, we're talking about how many beats or how many times the heart beats or contracts per minute. Sinus rhythm is the normal heartbeat. So that's that normal beat. While an arrhythmia is any kind of abnormal heartbeat. Maybe it skips a heartbeat, maybe it adds an extra heartbeat in somewhere. That's where an arrhythmia would come into play. Systole, as we mentioned before, was that contraction. That diastole is that relaxation or rest. So disorders of the heart. So those arrhythmias are abnormal or irregular heartbeats. There are technically 6 types of commonly seen arrhythmias. A premature beat is often associated with caffeine and stress. They kind of feel like the heart skips a beat. Atrial fibrillation occurs when the atria kind of quiver and they don't completely contract, so they don't get rid of all the blood that is in them. And this can cause blood to clot and pool in the atrium. It causes a paroxysmal atrial tachycardia, which is a period of rapid but regular beats. Ventricular tachycardia. This is a rapid heartbeat that's coming specifically from the ventricles. Ventricular arrhythmia is an irregular heartbeat of the ventricles. Heart block. This is an interference in the electrical conduction system of the heart. It's causing no coordination between the atrial and ventricles contracting. They usually work together. So when a heart block, they do not. And then palpitations are uncomfortable sensations of rapid, irregular heartbeats. So we've got some different ways that we can treat disorders of the heart. A pacemaker is one of those. A pacemaker helps to set the person's heartbeat. So it can assist in a rhythm that may have become dysfunctional, or they can operate all of the time and override that patient's heartbeat. We can put an implantable defibrillator. This gives the heart a small electric shock when it goes into fibrillation to correct that rhythm, kind of get it back on its normal beat. Kind of that shock stops to reset that heartbeat. And then we have an automatic external defibrillator. This is also, again, a defibrillator that sends an electric shock through electrodes placed on the chest to stop the heart and allow the heart to restore a regular rhythm. Anybody who's been trained in CPR or will get trained in CPR, depending on what field you're going into, will learn how to use an automatic external defibrillator. So an unpleasant sensation of a rapid beat of the heart is that palpitation. Restoration of a normal heart rhythm by electric shock is called cardioversion. Uncontrolled quivering of the heart muscle is that fibrillation. An AED is that automatic external defibrillator. ICD is an implantable defibrillator. It could be cardioverter, defibrillator. PVC is premature ventricular contraction. AFib, atrial fibrillation. VFib, ventricular fibrillation. And then we have VTach, ventricular tachycardia. So disorders of the heart. We can have heart valve malfunctions. So let's look at the heart first, because this is the first picture we have of the heart. So we have our atrium, our right atrium, this top chamber in blue, left atrium, this top chamber in red. We have our right ventricle, which is this bottom chamber in blue, this left ventricle, which is this bottom chamber in red. We have our valves. We have a tricuspid valve, which means there's 3 cusps to it. We have a mitral or bicuspid valve, which means it has 2. Then we have the pulmonary semilunar valve and the aortic semilunar valve. So let's look at what some of these mean. Stenosis. Stenosis is when the valve does not fully open and the opening is constricted. So it doesn't open enough. So it could happen to any of these four valves. So it's harder to push blood through. Incompetence is when the valve does not close fully and blood regurgitates back through. So a backwards flowing of blood. We can have aortic stenosis, which can happen in the elderly population. We can have mitral valve stenosis or incompetence, which can lead to chronic heart failure. If the valve requires replacement, there are two types available. We have mechanical or prosthetic valves that are made of alloys and plastic, and tissues, which comes from a pig, cow, or even a human heart. Rheumatic fever. Anybody ever had strep throat? If you don't get that virus or that, bacteria taken care of, it can, by antibiotics, it can get into your heart. It can get into your heart and cause heart valve problems. Those valves eventually fail to work and they require a valve replacement. And the sad thing is this usually happens in childhood. So endocarditis, endo, inside, cardi, the heart, itis, and inflammation. So endocarditis is most common in drug abusers and people with damaged heart valves. Myocarditis deals with that muscle. So it's inflammation of the heart muscle. Pericarditis, we said where that pericardium, that sac around that heart. Well, that sac around that heart gets inflamed, infected, and it constricts that heart movement. So the heart cannot contract completely. Cardiomyopathy is a weakening of that heart muscle so that it pumps ineffectively, and this can occur in young people. Cor pulmonale is a failure of the ventricles to pump properly, and it's usually that right ventricle. Pericarditis is an accumulation of fluid to a mass between the heart and its outer lining. This fluid will cause the heart to become compressed against this fluid-filled sac. It causes tamponade when that heart muscle cannot contract and expand normally, and cardiac output is then gonna fail. Incompetence and insufficiency describe a valve that does not completely close. This allows blood to flow back or regurgitate into the heart chamber where it was coming from. So back to my heart. So blood is going to come in here, go here, and go out. Then it'll come back into the heart here, and then it's going to go back out this way. So if this valve right here does not close, as blood travels down, if it doesn't close, the blood's going to go back up. Same thing here. If this valve doesn't close all the way, blood's going to travel back down. That's regurgitating. So let's look at some disorders of the heart. Coronary artery disease. Arteries can become narrowed by plaque deposits that are also called atheromas. So when this plaque starts to build up inside of artery walls, blood flow is reduced. This narrowing of coronary arteries. Coronary arteries are the arteries on the outside of the heart that give that heart muscle oxygen that it needs to pump. Narrowing of those blood vessels reduces blood flow to that heart muscle specifically. So angina pectoris, this is chest pain on exertion. It's usually the first symptom of reduced oxygen supply and blood flow to that heart muscle, that myocardium. Myocardial infarction. This is another word for, or the medical term for, a heart attack. This is when blood supply is cut off to an area of that heart muscle and that tissue dies. Myocardial infarction means death of heart tissue. Cardiogenic shock is going to cause a weak, rapid pulse and a decreased blood pressure in a patient who is pale, cold, sweaty, and anxious. Asystole is a flat line on an ECG, and it indicates the heart is in this cardiac arrest. So there's no electrical or conduction activity happening in the heart when somebody is in cardiac arrest. Their heart's not pumping. Your heart can beat on its own. It has its own conduction system, and this conduction system is not working. So coronary artery disease, heredity, so genetics, your family, somebody in your family has it, you're more likely to have it. The older you are, more likely you are. Obesity. Obesity causes a lot of different conditions. Coronary artery disease is one of those. A lack of exercise. Exercise works your heart. It exercises your heart. It helps you burn fats. Burning more fats prevents your body from storing it different places in the body. Tobacco. Smoking can cause just about any condition in the body lately. Diabetes. Again, not treating blood sugar, high blood sugar levels. Stress. Type A personality. These people usually have a really high stress. High blood pressure, meaning the heart needs to work harder to push that blood out of the heart. And elevated serum cholesterol. Higher levels of cholesterol increases your risk of coronary artery disease. These are all risk factors except hereditary and age. Most of these can be reduced by lifestyle changes. The problem is a lot of people they get stuck in their ways and they don't like to change up their lifestyle. Diet, lowering your blood sugar, lowering your cholesterol levels. Those aren't listed there, the cholesterol levels, but those are two ways. Stop smoking, start exercising. Exercise will reduce your stress levels. So that's killing two birds with one stone there. But these are different ways that you can lower your risk of cardiovascular or coronary artery disease specifically. So more abbreviations here. CAD. Coronary artery disease. ASHD. Arteriosclerotic heart disease. MI, myocardial infarction. PNB, pulseless non-breather. Occlude versus profuse. Occlude means a blockage, while profuse means it's free, blood is free flowing. Sublingual is linguals for tongue, so under the tongue. Substernal, under the sternum. Arteriosclerosis means hardening of the arteries with a loss of elasticity, while atherosclerosis means a plaque buildup in the arteries and is the most common form of arteriosclerosis. Hypertensive heart disease or hypertension affects about 20% of the adult population. That's actually quite a bit. There's 4 different types of hypertension. High blood pressure. Hypertension is that high blood pressure. There's primary or essential hypertension, which we don't know the cause of. Secondary hypertension usually results from some other disease, like kidney disease, hyperthyroidism can cause high blood pressure, stress can cause high blood pressure. Malignant hypertension is a sudden and rapid onset of a life-threatening hypertension, high blood pressure. Occurs in young adults and is often associated with kidney disease, and it also occurs in women with toxemia of pregnancy. And then we have prehypertension. Prehypertension is when that blood pressure, that top number of that blood pressure, that systolic, is below 139 and that diastolic is between 80 and 90. They keep lowering the numbers. So pretty soon everybody's going to be considered hypertensive. Unfortunately, there are people that are not, those who exercise daily, but people who don't are soon going to be on that scale everywhere, which is kind of sad. Congestive heart failure is the inability of the heart to supply enough cardiac output to meet the body's metabolic needs. Congenital heart disease, congenital means it's present at birth. So it's that result of an abnormal development of the heart in the fetus. An atrial septal defect is when that blood flows from that right to that left atrium. So that there's a hole in that atrium that usually closes up. So an atrial septal defect, that hole does not close up. Ventricular septal defect is when blood flows from that left ventricle into that right ventricle. Ductus arteriosus or patent ductus arteriosus. This does not close at birth. There's blood that is flowing where it shouldn't. The lungs are the first place to be damaged. And then coarctation of the aorta is this narrowing of the aorta. This patent ductus arteriosus is when the aorta and that pulmonary valve or vessel, there's usually a hole so that blood can travel through, since blood doesn't need to be oxygenated from the lungs in utero. Oxygen is coming from the placenta. So that hole between those two vessels does not close up. And then we have tetralogy of Fallot. This is when we have all 4, atrial septal defect, ventricular, patent ductus arteriosus, and coarctation of the aorta. All 4 of these are present. They can be surgically repaired, but they usually have to do it while that fetus is still in the uterus. Because these fetuses don't usually survive outside of the uterus very long at all. Okay, let's look at some of these words here. Hyper, I had mentioned it before in another chapter, but hyper means excessive or high blood pressure. 10 That tens means pressure. And that ion means a condition or action. So hypotension, hypo means low or below. This is low blood pressure. We already defined hypertension, so pre means that precursor to hypertension. Ooh, a lot of abbreviations. So let's look at what words we've already looked at here. Atrial, septal defect, VSD, ventricular septal defect, CHD, congenital heart disease. Well, CHF is congestive heart failure. HG, mercury. Whoops, that's not how you spell mercury. There we go. HTN, hypertension. PDA, patent ductus arteriosus. SOB, shortness of breath. And TOF is that tetralogy of Fallot. Okay, so a lipid profile, this is a blood test that can help us determine this person's risk of coronary artery disease. And what we check total cholesterol, which is made up of high density lipoproteins, which is your good cholesterol, and then your low density lipoproteins, which is your bad cholesterol. Your low density lipoproteins will take fats and put them, they're supposed to take and deliver them to your fat cells, those adipose cells. But if there's so much cholesterol, they start to get haphazard and place them anywhere around the body. This is what can cause that cholesterol to build up and block off blood vessels, that atherosclerosis. Your HDLs, your good cholesterol, will go take that cholesterol that those LDLs put somewhere. They'll go remove it and put it where it's supposed to go. And then we have triglycerides. Your most common forms of fats. So there's a lot of different ways that we can diagnostically test and look at how the heart is functioning. That ECG or EKG, this is a paper record of those electrical signals sent by your heart. Cardiac stress testing is an exercise tolerance test to raise the heart rate and monitor its effects on that cardiac function. Echocardiogram uses ultrasonic waves to study that heart function. A Holter monitor is a continuous ECG that is recorded over like a 24-hour period. ambulatory blood pressure monitor. It provides a record of blood pressure over a 24-hour period as that person goes about their daily life. Magnetic resonance imaging. With the heart, it can provide detailed images of that heart and identify sections of that cardiac muscle that is not receiving enough blood. Cardiac catheterization, there we go. This detects patterns of pressure and blood flow in the heart. A thin tube is threaded into the heart under X-ray guidance and is being inserted into a vein or an artery. And then we have a coronary angiogram. This uses contrast dyes that are injected during cardiac catheterization to identify coronary artery blockages. So some different ways to treat. Thrombolysis. Thrombus is a blood clot. So thrombolysis is using a medication to help dissolve blood clots. They use this within blocked vessels so that blocked blood vessel can reopen and flow. Precutaneous transluminal coronary angioplasty. This is a procedure where a balloon is used to open a plaque-filled vessel by compressing the plaque against the wall of that vessel and restoring normal blood flow again. A stent. This is a device that's helped to prop open blood vessels and keep opened a narrow vessel. So again, it's pushing that atherosclerosis up against that wall, that plaque up against that wall, but that stent is helping to prevent it from reforming. And then we have a coronary artery bypass graft. This is where they take that blocked vessel and it is bypassed by using a healthy blood vessel taken from the arm, the leg, or the chest and put into that heart so that heart can get enough blood to all of its necessary tissues. So different treatment procedures. Cardioversion involves converting a cardiac arrhythmia, so an abnormal heart rate, into a normal rhythm by electric shock to the heart from a defibrillator. And that defibrillation, sorry, I added an extra sound in there. Atrial or ventricular fibrillation is terminated, so it's stopped, and normal rhythm is restored by delivery of an electric shock to that heart. And then a heart transplant. In a heart transplant, they have to match the tissue to decrease the likelihood of rejection reaction. So let's define these different terms here. Echo is going to mean sound. Cutaneous means skin. Thrombo is blood clot. Sclero is hardness. Arterio, artery. Idio is unknown. So some things are idiopathic, of unknown origin. Angio is that blood vessel. And veno is vein. Now let's look at our suffixes. Whoops, gram. I just rewrote the same word again. Gram means to record. So, angiogram. Plasty is that Plasty is that surgical repair, like angioplasty, repairing that blood vessel. Eyes is action. This is like catheterize us pertaining to. Tick is also a pertaining to, and I'd is having a particular quality, like triglyceride. Tick, thrombolytic, us, percutaneous. So different pharmacological drugs that we can use for the heart and blood vessels here. Anticoagulants. These are drugs that help reduce susceptibility to blood clot formation. Heparin is a main one. Oronotropic drugs, they're going to alter your heart rate. So positive oronotropic drugs like epinephrine or adrenaline, norepinephrine, and atropine are going to increase that heart rate. We also have negative chorionic drugs, such as quinidine, procanamide, lidocaine. These are going to slow the heart rate. Ionotropic drugs. They can be positive or negative. So positive ionotropic drugs increase the force of that ventricular contraction, which increases cardiac output when the function is impaired, as in congestive heart failure, cardiogenic shock, and cardiomyopathy. Digitalis and its derivatives. Digitalis is actually from a plant that pharmaceuticals have taken and commercialized. Negative ionotropic drugs decrease the strength of the ventricular contractions and are used to treat hypertension, angina, and heart attacks, like beta blockers, calcium channel blockers. And then we have antiarrhythmic drugs. So they're going to change the electrical properties in that heart to restore a normal rate and rhythm to this heartbeat, like beta blockers. They can reduce the strength and rate of myocardial contractions and are used to treat arrhythmias. We have vasoconstrictor drugs. These contract the smooth muscle found in blood vessels. So they make those blood vessels smaller. And it can increase both atrial and venous blood pressures. They are called pressor drugs. These drugs are used to help resuscitate seriously ill patients and for treatment of hypotension in the operating room or OR. Vasodilator drugs. These help to relax the smooth muscles and arterioles, so make them larger, which leads to a drop in blood pressure, like a nitroglycerine. A lot of times this is a patch. It can be, or sublingually. It can be given under the tongue for rapid action, and it can last. Rapid action, so it takes seconds to work, and it can last up to 30 minutes. Or those transdermal patches that I said that last up to 12 hours. ACE inhibitors, angiotensin 2, receptor blockers, calcium channel blockers. There's also diuretics. Diuretics have an indirect effect on the heart because they're causing you to lose water, more water through urine production. So it increases urine production by decreasing that fluid volume of your blood. Lasix, thiazides. We also have lipid regulating drugs. that inhibit the progression of atherosclerosis by lowering bad cholesterol, or those low-density lipoproteins, LDLs, and or increasing that good cholesterol, or those high-density lipoproteins, HDLs. Statins will lower LDLs but carry a risk of muscle damage. Fibrates, niacin, are going to work to lower triglycerides. Niacin is one of your B vitamins. Let's look at the circulatory system. We've talked about them a little bit, but let's go into more detail now. Arteries are going to carry that oxygenated blood to our tissues. Veins carry deoxygenated blood to the heart. So it still may have oxygen in there, it's just less oxygen. An angiogram is a study of the internal arterial walls, while the venogram is a study of the interior venous walls. That circulatory system refers to the heart and the blood vessels, and its two major divisions. We have the pulmonary circulation, which carries that deoxygenated blood from the heart to the lungs and returns it back to the heart full of oxygen. And then that systemic circulation, which supplies oxygenated blood to every organ except the lungs, and then returns that deoxygenated blood back to the heart. So let's look at the functions of that circulatory system. It works to transport oxygen, nutrients, hormones, and enzymes. These are going to diffuse from the blood into the cells. And then it also transports waste products like carbon dioxide that diffuse back from the cells back into that blood supply. And it's carried to the lungs, the liver, and the kidneys to get rid of. It's going to help to maintain homeostasis through that systemic circulation that directs blood flow to tissues to enable them to meet their metabolic needs. It's going to regulate blood pressure. So those arteries and that systemic circulation can expand or constrict. They dilate or that constriction in coordination with that systole and diastole of that heartbeat to maintain a steady flow of blood and blood pressure to the tissues. So let's break apart some words here. Brachy is going to mean brachial or arm. Vena is vein. That does mean arm. Vein. Palpat means to touch. And then capil means hair-like structure, like a capillary. So let's look at where we would find these in the body. Radial artery is in that forearm, through the wrist, and it actually goes down into some of your fingers. Temporal artery is at the side of the head. Carotid artery is in that neck. Femoral artery is that upper thigh. And then we have our brachial artery is in the arm. That upper arm to that elbow. Disorders of the veins. Thrombophlebitis, deep vein thrombosis, and varicose veins. Varicose veins are veins that have lost their elasticity, so they don't stretch. They've become swollen, and they do become very painful. Thrombophlebitis is an inflammation of the lining of those veins. Deep vein thrombosis it's a blood clot in a vein that can be caused by immobility, prolonged travel, and contraception usage, such as estrogens. Arteries. An aneurysm is a dilation of an artery caused by weakness in those walls of that vessel. Thromboangiitis obliterans is an inflammatory disease of arteries with clots or thrombus formation that's usually found in the legs. Raynaud's disease is spasm of these small blood vessels, these small arteries that supply the fingers, hands, and feet. It's usually following exposure to cold, but it can be associated with connective tissue disorders like scleroderma and lupus. And then carotid artery disease is that buildup of that plaque in that carotid artery that is reducing that blood flow to the brain. So let's look at the root element of these words. Collateral means lateral, means at the side. It's situated at the side, often to bypass an obstruction. And arterectomy, artery, surgical removal of plaque from an artery. Phlebotomist. Phleb, is that combining form that means vein. So this is somebody who takes blood from a vein. Sclerose or sclere or hardening is the hardening or thickening of blood vessels. Edematous or edema is swelling due to excessive fluid in the tissues. So the heart is always working. If it fails to circulate blood, tissues stop receiving oxygen and nutrients. Wastes start to accumulate and cells will start to die. Blood flow through the body by following one of the three circuits allows the body to deliver blood everywhere in the system. Your vital signs measure temperature, pulse, respiration, and blood pressure to assess your cardiorespiratory function. So cardiovascular and respiratory systems. A loss of consciousness is usually precipitated by exertion and can be due to cardiac arrhythmia or cardiomyopathy. Malfunction of a heart valve will lead to improper circulation of blood in the body. Thank you very much for listening. This was a wonderful chat on the heart and blood vessels. Thank you very much. Bye.